If it feels like there is a pebble or a wrinkled sock under the ball of your foot, with burning or tingling that shoots into your toes, you might be dealing with a Morton's neuroma. It is a common cause of forefoot pain, especially between the third and fourth toes, and many people describe needing to stop, take off their shoe, and rub their foot to get relief. It can be frustrating, but it is not dangerous, and a lot of cases improve with simple changes. In this video I will explain what is actually happening in your foot, why it burns. Despite the name, a Morton's neuroma is not a true tumor. It is a thickening of the tissue around one of the small nerves that runs between the long bones of your foot, called the metatarsals, on its way to the toes. When that nerve gets repeatedly compressed and irritated, it becomes swollen and sensitive, which is why pressure and certain shoes set it off. Tight, narrow, or high-heeled shoes squeeze the bones together and pinch the nerve, and activities that load the ball of the foot, like running or prolonged standing, add to the irritation. Foot shapes such as bunions, flat The classic symptoms are burning, tingling, or a sharp electric pain in the ball of the foot that can radiate into the toes, often with a feeling that your sock is bunched up even when it is not. Many people get numbness in the affected toes, and the pain typically eases when they remove tight shoes and massage the area. Symptoms tend to flare with narrow footwear, high heels, and prolonged activity, and improve with rest and roomy shoes. In the clinic, a clinician can often reproduce the pain by squeezing the foot from the sides while pressing on the tender spot, sometimes producing a click. In most cases the diagnosis Here's the reassuring part. Many people improve with simple, non-surgical changes, and footwear is often the most powerful one. Switching to shoes with a wide toe box, low heels, and good cushioning takes pressure off the irritated nerve. A small pad placed just behind the ball of the foot, called a metatarsal pad, can help spread the bones apart and offload the nerve, and supportive insoles may also help. Avoiding tight or high-heeled shoes and reducing high-impact activity during flare-ups gives the nerve a chance to settle. Over-the-counter pain relievers may ease discomfort, though it is Alongside better shoes, some gentle self-care can keep the foot comfortable and mobile. Calf and foot stretches help, because tight calves can increase pressure on the forefoot. Many people find relief from gently massaging the ball of the foot and rolling it over a cool bottle or a soft ball to ease tension. Simple toe and foot mobility exercises, like spreading and stretching the toes, can keep things supple, and strengthening the small muscles of the foot may improve support over time. A good rule of thumb is that gentle stretching should feel like a mild release, not a sharp jolt into the toes, so ease off if pain spikes. So when should you stop self-managing and get evaluated? See a clinician if the pain is severe or steadily worsening, if you have significant swelling, redness, or warmth in the foot, or if you develop fever, which could suggest infection. Also seek care if the foot becomes numb or weak, if you have diabetes or poor circulation and notice new foot pain, or if sensible changes to footwear and activity have not helped after several weeks. A sudden, sharp pain after an impact could be a stress fracture rather than a neuroma and deserves a closer look. To recap, a Morton's neuroma is an irritated, thickened nerve in the ball of the foot. It is common and not dangerous, and most cases improve with roomy shoes, padding, and gentle self-care.